Weight loss is not as simple as calories in, calories out. So we know that obesity is a chronic, complex disease. Unfortunately, a lot of society and even medical professionals still view obesity as a lifestyle choice. And that's an inaccurate and prejudiced view towards patients living in larger bodies and trying to live healthy lives. My patients agree that no one would choose to live in a body that's causing them pain or discomfort or additional medical problems. Plus, this incorrect view of obesity essentially means that we're not actually serving our patients and we're not helping them lose weight. Because if it was as simple as eat less, move more, then there wouldn't be a multi-billion-dollar dieting industry. Because if weight was as basic as calories in, calories out, that also wouldn't explain why most of us have a friend who can eat whatever they want and never gain weight. So there's got to be more to it. Now, when I say that obesity is a disease, I don't mean that there's something wrong with you. What I mean is your hormones and your genetics basically determine the size of your body based on the environment that you're living in. And in obesity, your body is storing energy as adipose tissue or fat inappropriately when it doesn't have to survive. So it's basically not doing what it's supposed to do. In terms of genetics, there are over 50 genes that are directly linked with obesity, and most of them exert a small effect based on the environment that they are essentially exposed to. So for example, these genes can be impacted by medications you've been on throughout your life, other diseases you might have, your mental health, how well you sleep, how sedentary you are, your gut bacteria, or hormonal changes throughout your life. So simply put, your genetic makeup predisposes you to either gain weight or lose weight based on the environment that you're living in. And for the most part, these genes are driven by the evolutionary goal of survival. So your body's main goal or drive in life is to stay alive, especially in a time of famine. So when you start to lose weight, even when it's intentional, your brain panics and assumes you must be starving to death. So to help you, your body stores energy as adipose tissue or fat. So this way, if there's another famine, you'll survive because you have excess energy stores that you can burn as fuel. But in the case of obesity, your body isn't acting appropriately and it really doesn't need to store excess energy stores as fat to survive. So it's this metabolic dysregulation that makes obesity a disease. As I said, essentially your body's not doing what it's supposed to do. Okay, so we've talked about the role of genetics. Let's address the role of hormones in weight. We know there's at least 30 hormones involved in appetite and weight regulation. I'm not going to go over all of them today, and we have another video about the hormones related to weight that you can check out if you want to learn more about that. To keep things simple, let's talk about how your hormones respond to weight loss. So regardless of whether you're trying to lose weight through low carb diet, low fat diet, calorie restriction, basically all the studies look the same. People lose weight and then they tend to plateau and then they regain weight. And oftentimes they regain more weight than they were actually at to start. So you started your weight loss goal and now you're actually even at a higher weight than when you started. And understandably, this is incredibly frustrating and defeating and makes you wonder, why bother trying to lose weight at all? And then meanwhile, society is just telling you, eat less, move more, problem solved. But there's no amount of willpower that can override the hormonal response, or starvation response that we'll call it, to weight loss. Your brain doesn't realize that when you intentionally lose weight, luckily for most of us, it's not because we have a lack of food. But your body doesn't realize this and it's stuck in caveman mode and it thinks you're starving to death, so it tries to help you and tries to help you stay alive by increasing the release of a hormone from your stomach called ghrelin. So ghrelin makes you way hungrier than you need to be, and it actually tells your brain to go out and seek food and eat food even when you don't need it. And then at the same time, something called metabolic adaptation or adaptive thermogenesis is occurring. So when you lose weight, your resting metabolic rate, which makes up about 70% of your calories burned per day, it decreases. However, this reduction is larger than necessary and out of proportion to the decrease in fat mass that you have with your weight loss. So you're burning fewer calories at rest, having done nothing differently. So it's kind of like you ate an extra meal each day, and then your body stores that extra calorie feed as fat. And this explains why some patients tell me, I barely eat anything and I cannot lose weight. Now, I'm not telling you all of this to discourage you. In fact, learning about the science of obesity is helpful because it gives us the knowledge and tools to treat it. And understanding this means we can offer safe and effective medications that essentially convince your body that you're not starving to death and there's no need to hit the panic button. Instead of saying it's not a matter of having enough willpower, I'm here to say it's not your fault. We know that using the old-fashioned approach of telling someone to just try harder to lose weight is like telling someone with asthma to just take a deep breath, which is completely absurd, and we would never say that. Understanding your brain and gut chemistry means we can offer behavioral, nutritional, and medical interventions that can lead to lifelong weight optimization. I often hear from my patients that this understanding and the potential treatment options give them hope for the first time. I hope it does for you too.